Everybody, I'm Oliver Niño. I am a student of medicine in the Universidad Nacional. In this occasion, I'm going to talk about my career, medicine. Well, medicine is the art of and science of healing. It encompasses a range of healthcare practices involved to maintain and restore health by the prevention and treatment of illness. Contemporary medicine applies health sciences, biomedical research, and medical technology to diagnose and treat injury and disease, typically through medication, surgery, or some other form of therapy. The word medicine is derived from the Latin ars medicina, meaning the art of healing. The root of Asclepius is the symbol associated with medicine, which comes from the Greek god of medicine and healing, Asclepius. In clinical practice, doctors personally access patients in order to diagnose, treat, and prevent disease using clinical judgment. The doctor-patient relationship typically begins an interaction with an examination of the patient's medical history and medical record, followed a medical interview and a physical examination. Basic diagnostic medical devices, for example the stethoscope, is typically used. After examination for signs and interviewing for symptoms, the doctor may order medical tests, for example blood test, take a biopsy, or prescribe pharmaceutical drugs or other therapies. Differential diagnosis methods help to rule out conditions based on the information provided. During the encounter, properly informing the patient of all relevant facts is an important part of the relationship and the development of trust. The medical encounter is then documented in the medical record, which is a legal document in many jurisdictions. The main branches of medicine are basic science of medicine, medical specialties, and last interdisciplinary fields. So, medicine can be divided in surgery and medicine as a specialty. Surgical specialties employ operative treatment. In addition, surgeons must decide when an operation is necessary and also treat many non-surgical issues, particularly in the surgical intensive care unit, where a variety of critical issues arise. Surgery has many subspecialties, for example, general surgery, transplant surgery, trauma surgery, cardiovascular surgery, neurosurgery, maxillofacial surgery, orthopedic surgery, otolaryngology, plastic surgery, oncology surgery, vascular surgery, and pediatric surgery. Now, medicine also can be divided in medicine as a specialty. Internal medicine is the medical specialty concerned with the diagnosis, management, and non-surgical treatment of unusual or serious disease, either of one particular organ system or of the body as a whole. According to some sources, an emphasis of internal structures is implied. The specialists in internal medicine are commonly called internists. Because their patients are often seriously ill or require complex investigations, internists do much of their work in hospitals. Formerly, many internists were not subspecialized. Such general physicians will see any complex non-surgical problem. This style of practices has become much less common. In modern urban practice, most internists are subspecialists. That is, they generally limit their medical practices to problems of one organ system or to one particular area of medical knowledge. But there are many subspecialties of internal medicine, like cardiology, critical care medicine, dermatology, emergency medicine, endocrinology, gastroenterology, geriatrics, hematology, hepatology, infectious disease, nephrology, neurology, oncology, pediatrics, pulmonology, rheumatology. Well, this is my career. I hope that you like it. Now I'm going to talk about my favorite theory in medicine. It's called cell theory. Cell theory refers to the idea that cells are the basic unit of a structure in every living thing. Development of this theory during the mid of 1600 was made possible by advance in microscopy. This theory is one of the foundation of biology. The theory says that the new cells are formed from other existing cells and that the cell is a fundamental unit of a structure, function and organization in a living organism. The cell theory states all living things or organisms are made of cells. New cells are created by all cells dividing into two. All cells are similar to each other, but not identical. Cells are the basic building unit of life. The observations of Hooke, Leeuwenhoek, Schleiden, Schwamm, Virchow, and others led to the development of the cell theory. The cell theory is a widely accepted explanation of the relationship between cells and living things. The cell theory holds true for all living things, no matter how big or small, or how simple or complex. Since according to research, cells are common to all living things, they can provide information about all life. And because all cells come from other cells, scientists can study cells to learn about growth, reproduction, and all other functions that living things perform. By learning about cells and how they function, you can learn about all types of living things. These are the exceptions to the cell theory. Viruses are considered alive by some, yet they are not made up of cells. Viruses have many features of life, but by definition of the cell theory, they are not alive. The first cell didn't originate from a pre-existing cell. There was no exact first cell since the definition of cell is in process. Mitochondria and chloroplasts have their own genetic material and reproduce independently from the rest of the cell. So, this was a little explanation about my favorite theory of medicine. Hope you have enjoyed it.